Okay, so stop recording, re-recording again, special test. So, where is this going? So this is the right side, I'm doing the unaffected side first. So let's do the MCL, so the Valgus Stress test. Okay, so that's performed at 0 degrees of extension, and of full extension and 30 degrees of flexion. I'm going to do the Beerus stress test. Again, 0 degrees and 30 degrees of flexion. Then the anterior drawer, posterior drawer. Then let's do the stable lockman.
It's really ticklish.
Stable lockman. Okay, so then I'm going to do the posterior sag sign. Bring both of the knees, the legs up, and observing for the tibial tuberosity being lower on one side over the other. Then I'm going to do the Mcmurray's test. Go internally rotate, go into flexion, extension, external rotation, the tibia, flexion, and extension. Okay, then I can do the lateral pivot shift. That's where I provide a internally rotate the tibia, lateral, go down into extension, and come back up, then externally rotate, lateral, Valgus stress, into extension, and into flexion. Good. Then I'm going to have you on your stomach. I want to make sure I do the patellar grind test, so I don't want to forget that. So let's get this down underneath your stomach. Patellar grind, patellar grind, patellar grind. Okay, so that's your right side, this is your left side. So we'll do the Palpate distraction test. I'm going to stabilize the distal femur, distract, internally rotate for LCL, laterally rotate for MCL. Then I'm going to do the Palpate's compression test, stabilize distally on the femur, compress on the calcaneus, internally rotate for lateral meniscus, internally rotate for lateral meniscus. Have you stand up, please? I'm going to have you do the Thessalys test now, so that's where I'm going to have you on your, again, on your unaffected side first, then I'd test the affected side after that. So on your left leg, I'm going to have you take your lift your right leg up. I'm going to have you kind of, it's like just a slightly bent knee. Maybe you just kind of twist and shimmy. Good, and then I'm going to have you slightly bend it even more so, and twist and shimmy. This is for the medial lateral meniscus. Good. Then I'm going to have you, now I'm going to do the patellar grind test. So I'm going to have you sit on the table, please. So patellar grind is where it's not a patellar grind. This is the, what test is this called? I'm going to palpate the patella, and I think it's called the Patellar Tap test. I can't remember what it's called, but either way, we gotta do it anyways. So I'm gonna palpate your patella while you actively extend the knee. Okay? Alright. So I'm feeling for stuttering, so I think it's called the patellar stutter test. Okay. Now I'm gonna do the patellar grind. So now I'm gonna have you lay back on your back again. Again, I'm testing the left side, the unaffected side first. So this is where I provide a superior motion of the patella. Inferior motion of the patella. And then I'm going to have you contract your quads. And then then the patient would feel pain or apprehension with this. And try it again. Do it down by the patella. Maybe contract the quads again. Good. That would cause pain to the patient with the patellofemoral pain syndrome. Those are all the special tests. of the knee. And then I'm going to do palpation for tenderness. So you're good right there. So I'm going to palpate the left side again first, and then I palpate the right bilaterally as I would with all of these tests. So I'm going to palpate the medial epicondyle, medial femoral condyle, medial joint line, the knee, palpate the MCL, palpate the LCL. I'm going to ask you to actually cross your leg. I can feel the LCL right there in the lateral joint space. Then I'm going to palpate the patella. I'm going to palpate the quadriceps tendon. I'll palpate the lateral patella ligament. Then the patellar tendon, both at the tibial tuberosity and just underneath, distal to the patella. I'm going to also palpate behind the knee, posterior medially, posterior laterally. Okay, so that's all of the special tests and palpations for tenderness. So now I'm going to ask for the findings for special test, please.
Ready?
Yeah, so the Valgus, apicompression, apodistraction, Mcmurray, Thessalys, Lockman, patellar compression grind, Beerus, lateral pivot shift, anterior door, posterior door, sag side, patellar tap test. Yep, did all of them. Yes, please let me know the special test.
Positive patellar compression.
Positive patellar compression, so that's grind. Okay.
Negative stutter.
Negative stutter test. Okay.
Oh, I think all these are supposed to be negative. So I think it's negative stutter, negative valgus Beerus,
Okay.
negative anterior drawer,
Okay.
negative Thessalys compression and distraction,
Okay.
and then balance for 30 seconds on the left, 5 seconds on the right due to pain.
Is that special test? Is
Yep.
that under special
It's
test?
under special tests.
It kind of sounds like Thessalys, but I don't think so. So you said balance on the right was 30 seconds and balance on the left was 5 seconds?
Due to pain. Correct.
Due to pain. Okay. Is that it for special test?
Yes.
Okay. What about for palpation for tenderness?
Medial patella and medial retinaculum.
Yeah, that's what it's called. I said medial ligament. Medial retinaculum. So that's pain slash tenderness at the medial patella, medial aspect of the patella, and medial patellar retinaculum. Great. All right. So I'm going to go with patellofemoral pain syndrome at this point. You may want me to be more specific. And I could say, pain at the medial aspect, medial patellar retinaculum. It could be plica, but there wasn't a negative plica setter test. So oftentimes plica is at the medial aspect of the knee, but there's a negative plica setter test there, and positive patellar grind or compression. So in that sense, I'm going to say it's either patellar tracking pathology / just patellofemoral pain syndrome. All right. So the stage of condition at this point, it was 2 months ago when this happened, but it's getting worse. So I'm going to say it's chronic because of the length of time, but it could be chronic upon acute acute flare-up. Yeah. Then tissue reactivity is high, considering the patient, subject reactivity is high, sorry, considering the patient cannot perform her workout and aerobics due to pain. I would say that the tissue reactivity is probably moderate, considering it's strong and painful, with quad MSTT.
I'm sorry. I don't know what's going on.
Let's see, what else? Positive IT band, positive Obers, or Thessalys Test. Yeah. So I'm going to go with moderate tissue reactivity due to that. So that's pain, but at end range. Was able to complete those tests. Let's see. I'd say that prognosis is good to excellent, considering this is a standard musculoskeletal pathology that is easily treated and often treated in physical therapy. And I would see, what else can I say here? Patient is young, has no other comorbidities like that would prevent any delay in healing. Let's see. I would provide patient education. So for my plan of care, I'd provide patient education on pain-free ranges of motion, pain-free exercises, trying to avoid certain painful movements when she's working out. I know she said she cannot work out and do her aerobics class due to pain, but I would try to just advise, what motions I would advise to avoid certain motions and movements and activities until we can kind of get that pain under control. So I would try to do maybe some ice, maybe some e-stim to help with pain and swelling, kind of get it back down to more manageable pain tolerance, or just pain experience, and get some of the warmth and swelling down at that point. Maybe I could do some strengthening exercises in a pain-free range to help strengthen the musculature around there. I could do some affleurage to help get rid of some of the swelling in the area. And then I would eventually move on to, once the patient progresses and I feel it's appropriate, I'd do more rigorous strengthening exercises to help get her back to where she wants to do, which is working on and doing aerobics and doing stairs without pain. So I would do squats, I would do lunges, I would do longer quads with resistance. I would do exercise that would put stress onto patellar tendon and the affected tissues that are causing pain to the patient.